So, today we're going to dive into a story that is, both deeply concerning and, in the end, incredibly hopeful. It's about a childhood cancer called Wilms tumor. And this isn't just about a disease, it's really a look at one of modern medicine's most amazing success stories. It shows how decades of focused research can totally turn the tide against a really dangerous illness. But let's start with a question that gets right to the heart of why this is so scary for parents. I mean, how is it even possible for a tumor to grow, sometimes to a huge size, without causing any pain or any obvious signs that something is wrong? Well, the answer is kinda unbelievable. The discovery is almost always an accident. A parent is giving their child a bath, or a doctor is doing a routine checkup, and they just happen to feel a firm, painless lump in the belly. It's this silent growth which makes finding it a huge shock, but also, thankfully, the very first step toward a cure. So, what exactly is this tumor that can hide in plain sight like that? Let's get into the specifics of this silent discovery. Okay, so its official name is Wilms tumor, or nephroblastoma if you want to get technical. It is the most common kind of kidney cancer found in kids. Now, it's pretty rare. We're talking about 500 new cases in the US each year, but it's still a major focus in pediatric oncology. It usually shows up in kids under 15, and it's most common in toddlers, those younger than 2. Right, so like we said, that large, painless mass is the classic sign. But doctors are on the lookout for other clues too. About 1 in 5 kids might have some blood in their urine, and a quarter of them might have high blood pressure, which is caused by the tumor messing with the kidney. Less common signs, which you see in about 10% of cases, are things like a fever or unexplained weight loss. Okay, so once a mass is found, it's a race against time to get a really clear picture of what's going on inside. Think of it like this. Doctors need to create a detailed blueprint of the tumor before they can even think about how to attack it. This is the diagnostic phase, and it's absolutely crucial. The whole process is super systematic. First up is an abdominal ultrasound. It's quick, it's non-invasive, and it confirms if the mass is solid. Then they move on to a more detailed CT or MR scan. This is what gives the surgeons that critical 3D map showing the tumor's exact size, how it's sitting next to other organs, and, super important, if the other kidney is healthy. And finally, they'll do a chest CT to see if the cancer has spread to the lungs, which is a common place for it to go. With that blueprint in hand, doctors can now stage the disease. And staging is everything. It's the system they use to classify just how far the cancer has progressed, and that directly determines the entire plan of attack. And this, right here, is where that whole accidental discovery thing really pays off. Just look at this. Nearly half of all cases are caught at stage 1, when the tumor is still just in the kidney. I mean, that early detection is a massive advantage. The other stages, as you can see, represent cases where the tumor has already started to move. So let's break down what these stages really mean, nice and simple. Stage I, that's the best case scenario. The tumor is completely inside the kidney and the surgeon gets it all out. Stage 2 means it's grown a little bit beyond the kidney, but the surgeons were still able to remove it completely. Stage 3 is where it gets more serious. It means some tumor is left behind in the abdomen. Stage 4 means it has traveled to faraway places, like the lungs. And Stage 5, that's the unique challenge, where you find tumors in both kidneys right from the start. This detailed staging is what lets doctors launch such a precise and powerful counterattack. You see, the success against Wilms tumor isn't about one magic bullet. It's all about a combined strategy, a multimodal attack that uses both surgery and chemotherapy together. And let's be absolutely crystal clear on this point. While chemotherapy is a vital partner in this fight, the sources all emphasize that a meticulous, high-quality surgery is the absolute cornerstone of treatment. The cure really does start in the operating room. So here we can see the first step of that operation. The surgeon makes a pretty big incision to get a full view, exploring the whole abdomen. Then, with extreme care, they gently move the colon and other organs out of the way to get a clear path right to the tumor and the kidney it's on. Okay, now this next move is absolutely critical. Before the surgeon even touches the tumor itself, they find and ligate, or tie off, the main artery and vein that feed the kidney. This is a brilliant technique because it cuts off the tumor's blood supply and dramatically reduces the risk of any cancer cells breaking off and spreading while it's being removed. So once the surgeon has removed the visible enemy, the second wave of the attack begins. This is where chemotherapy comes in. It acts like a special forces team, hunting down and destroying any microscopic cancer cells that might have escaped the initial surgery. It's this 1-2 punch that stops the tumor from ever making a comeback. And all of this, the careful diagnosis, the staging, that multimodal treatment, it has all led to one of the greatest success stories in the entire fight against cancer. The results are just stunning. Take a look at this timeline. Back in the 70s, the 5-year survival rate was around 73%. Now that's impressive for the time, but it still meant losing more than 1 in every 4 children. Fast forward to the early 2000s, and that number has leaped to over 93%. This wasn't some single eureka moment. It was the result of decades of tiny, painstaking improvements, tweaking chemo doses, refining surgical techniques, and learning from every single patient. Let's just pause on that number for a second. 93.6%. That figure represents thousands of children who got to grow up, thousands of families that were kept whole. For a cancer diagnosis, that's not just a statistic, it is a revolution. So why did this happen? Well, it's a testament to the power of organized, cooperative research. Groups like the Children's Oncology Group have spent decades running these massive clinical trials, constantly refining treatments and sharing what they learned to get these incredible outcomes. And that brings us to our final thought. When you've achieved a cure rate of over 90%, the focus naturally starts to shift. It's not just about surviving the cancer anymore. It's about thriving after it. The next frontier is all about reducing the long-term side effects of the treatment, making sure these young survivors live long, healthy, and full lives. So the question that's driving tomorrow's research is, what does a cure truly mean?